Hello dear residents, welcome to this video. In this video, we are going to talk about a very important topic, that is treatment of schizophrenia. Now, treatment of schizophrenia is a very important topic. Of course, questions are asked in your viva when you are presenting a case related to treatment of schizophrenia if your patient is having schizophrenia. And of course, questions are also asked in grand rounds and even in the daily rounds when you're discussing near the bedside of the patient. Such questions are asked related to this topic. And of course, this topic is also very important for the theory paper. Many questions may come from this topic. And of course, needless to say, this is a very important topic which has very vast clinical implications. So let's discuss this topic. And these are the important headings under which we are going to cover the treatment of schizophrenia. We'll talk about the phases of treatment. So there are 3 phases of treatment. We'll discuss all these 3 phases, what are the focus during each of the phases, and what are the goals when we are treating the patient is under particular phase. Of course, we'll talk about the pharmacological management. In fact, we have 2 important modalities. One is pharmacological and the other is the psychosocial intervention, that is the non-pharmacological modalities. We'll discuss in great details about each of these modalities, and we'll also touch upon some important guidelines, some latest guidelines related to the treatment, especially the pharmacological management. And of course, we'll also talk about this very important topic, that is treatment-resistant schizophrenia. Sometimes questions may be asked just on this topic as well in your theory paper. So let's talk about the treatment of schizophrenia. And again, there are 2 modalities. One is the pharmacological and the other is psychosocial treatment. Now let's talk about the phases. So there are 3 phases, and you can remember these phases with the mnemonic ASM. A, that is acute phase. Second is the stabilization phase, and M, that is maintenance or the stable phase. Let's talk about these phases one by one. Now, acute phase basically presents to us, patient usually has positive psychotic symptoms and there may be related aggression or agitation. So, immediate attention is usually required for these symptoms. Now, also when we talk about acute phase, the patient may come to you in this phase as the first episode. So patient may has the first episode has come to you in acute phase, or sometimes it may be that there is a relapse. That means there is a prior episode and now there is a relapse. So again, the patient has now landed in the acute phase. Now in the acute phase, what is the focus? Our focus is first alleviating the most severe psychotic symptoms. So patient may be having delusions, hallucinations. So first is we should alleviate those severe psychotic symptoms and also returning to the baseline level of functioning. So these are the 2 important focus. So again, one should remember what are the important focus areas during each of these phases. Now when we talk about the duration, usually the duration lasts for around 4 to 8 weeks for the acute phase. Now in the acute phase, first is a comprehensive assessment is done, including psychiatric, medical, psychosocial assessment is done, and also we decide the goals of the treatment. So what are the important goals of the treatment in the acute phase? Again, when we talk about the goals, we can talk about these goals related to the patient. So patient related goals, then caregiver, again very important. This is very important. Whenever we are managing patient with schizophrenia, it's also important to consider the caregivers in mind. And also there are certain goals which are relevant to both the patient as well as to the caregiver. So let's discuss some of the important goals related to the patient. First is, as we discussed, eliminating or decreasing the symptoms, improving the level of functioning as we've discussed, promoting safety, again very important. Sometimes there may be some safety concerns related to the patient and also to the caregiver people around. So again, promoting safety is very important, decreasing the risk of harm both to self and to others, and also decreasing the stress. So these are some patient related goals. Then for caregivers, first is minimizing the distress. Many a times, especially if let us say it's the first episode, it has the first time that such symptoms have occurred. So this may create a lot of distress in the family members, in the caregivers. So again, it's important to minimize, offer them help to cope with this situation. And sometimes what we have seen that even the caregivers may be affected and may be having certain psychological issues. So one should try to offer help and help them coping with these symptoms. related to the illness of the relative. So it's very important to also address these concerns of the caregivers. Now, certain goals may be there which are relevant both for the patient as well as the caregiver, such as therapeutic alliance. So it's very important to have a therapeutic alliance with both the patient as well as the caregiver. Sometimes in acute phase it may be difficult initially to have a good rapport with the patient, but gradually one should try to develop a good therapeutic alliance. Again, active engagement in the treatment. Very important that whatever you're giving the treatment, you should discuss it with the patient as well as with the caregivers, and offer basic information regarding the illness, psychoeducation regarding the illness. It's very important, and also support to cater their needs. So any needs which is there, you should try to support that as well. Now, in the acute phase, so along with comprehensive assessment, deciding the goals, there is also one very important thing which is done is the treatment setting. We'll talk about this when we come to the treatment. So either the patient may be treated in OPD basis, outpatient, treatment can be done, or the patient may require admission, so inpatient. So again, deciding the treatment is also very important in the acute phase. Then also, in terms of what are the modalities which may be used during the management. So we know medication, especially antipsychotics, have a very important role. Then psychosocial intervention, ECT, of course, sometimes may be required. We'll talk about some of the important indications, and certain adjunctive medicines, for example, benzodiazepines may also be used. Patient may be having comorbid depression, so antidepressants. So along with antipsychotics, some other medication may also be required. So these are the important points. Along with this, also planning for future treatment. Again, in the acute phase, when the person comes, you should also have a long-term plan as well. So what are the future treatment which may be required, that should also be planned in advance as well in the acute phase. So these were some important modalities which we do in the acute phase. Let's talk about the second phase, or the stabilization phase. Now, as the name suggests, here in this phase, the acute symptoms have been controlled, but of course there is a risk of relapse. For example, if the treatment is interrupted, so if the treatment is interrupted, or there is some increased level of stress, that can increase the risk of relapse. So there are high chances of relapse, so one should be very careful in the stabilization phase. Now, the focus of stabilization phase is consolidating the therapeutic gains which we have got from the management in the acute phase, following the recovery from the acute symptoms, and also to prevent the relapse. So these are two important areas of focus when we are managing the patient in the stabilization phase. Now, the duration usually of the stabilization phase is up to 6 months. Again, these are some important duration which one should remember. So you talked about acute phase is around 4 to 8 weeks, and the stabilization phase is up to 6 months. Now, coming to the stabilization phase, first is determining the goals, patient related, caregiver related, and some may be for both. Then antipsychotic treatment, and usually it is the same as we have done in the acute phase. So antipsychotics which have shown good response in the acute phase, we usually continue them in the stabilization phase. Now, very important is the psychosocial interventions. Now, psychosocial intervention you may start in the acute phase, but many times we are not able to use them in so elaborate manner. So this is the phase in which more elaborate use of psychosocial interventions can be done for maintaining a treatment engagement, for adherence, very important. Offer support, preparing for community life. So patient is preparing for again going back to the community and doing the things as before. So that is again very important, and therefore it decreases the stress. So these are some important points under psychosocial interventions. Then also we have to continuously monitor the response, any side effects which the patient is experiencing, and also treatment adherence. And usually when we are talking about stabilization phase, you are seeing the patient mostly in the OPD basis. So again, these are certain important points which one should consider when we see the patient in the stabilization phase. Last is the maintenance or the stable phase. Now, in the maintenance or the stable phase, so patient is relatively usually in a remission phase, or symptomatically the patient is stable. Now, in this phase, what are the important symptoms which you may find? Many times, after the psychotic symptoms have decreased significantly, negative symptoms may still predominate the picture. So, negative symptoms may be there. And also, deficits in the social and occupational functioning may become more apparent in this phase. So, it's very important to also see these symptoms as well, not just seeing the decrease of positive symptom, but also we should see the patient holistically. Now, the focus in this maintenance or the stable phase is to prevent relapse or exacerbation of symptoms and also improvement of functioning. So we should try to have maximum functioning and maximum quality of life. So that should be the focus. So these are two important areas of focus in the maintenance or the stable phase. So again, when we are seeing this patient, we determine the goals, we reevaluate or modify the treatment plan. Again, this is important. Then assessment and monitoring of the response as well as side effects. It's very important to continue monitor the response as well as the side effect. Now, antipsychotics, again, we need to see. Usually we continue with the antipsychotic depending on the tolerability and the side effects, and also sometimes individually it's basically individualized treatment plans which we have for the patient, and we may decrease the dose if required. Then psychosocial interventions again become very important part during this phase as well. Rehabilitation again is important, and early intervention if there is a relapse. So sometimes during this phase, because of treatment interruptions, because of stress, there may be relapse as well. So one should be prepared and early intervention should be required. So because the patient and the family members now may be more aware of these symptoms if the patient had the first episode. So many times we are able to identify if there is a relapse early, and early intervention should be done. So these were the three important phases under which we treat the patient.